Okay, so good morning to everybody, and you know, we are everybody in a very strange situation, but we are human and we are able to adapt to any kind of circumstances. So try to find the positive point of view, and this could be one of those, to stay connected by internet and to be tuned and try to have a good interrelationships. I'm going to talk today of this kind of technology of BodyTite and FaceTite, focused on the face and neck, basically. I suppose that most of people that is connected as experiences, so I try to be more trying to share with you tips and tricks in order to be useful. And I always stay connected with the chat. So what we are going to do in order to have a more dynamic presentation, I will answer the question while you are writing me. So if you have any kind of question during my presentation, I'm trying to answer live on the moment. And my assistant Paloma and Clara, we will also take care of it in order to be to tell me if there are any question on the audience. So let's see. Okay, I think that most of you know me, but just tell you briefly that it's more than 10 years that I'm on this kind of minimal invasive treatment with different technologies. I've done more than 1,300 cases of lipo, and I am an international trainer. So I'm going to share with you my experience and what I have learned in these years. Not only the good things, but also my mistakes that I think that are also important too. If there are many technologies on the market, it means that there is not only one that is the best one for everything. So this is the first thing that we have to keep in mind. Of course, today we are talking about the benefit and the advantages of a BodyTite, but please keep in mind that there are many technologies, and there are different tools. And at the end, we are talking about tools that are in our hands. And in order to achieve the best result, we have to know how it works, and we have to have a learning curve. And I'm showing here which are the most famous technology, that is RF assisted liposuction, conventional liposuction, PAL vibro liposuction, ultrasound liposuction, that is the laser, and water assisted laser and water assisted one. Why I use RF? Basically because we have two main advantages. The first one is the temperature control, and the second one is that is very strong in the skin retraction. Why is so strong in the tissue retraction? Basically because of the technology. We have to talk about the technologies, and we are talking about radio frequency. Radio frequency means electricity. So we have a bipolar radio frequency. We have an internal pole and external pole, and we have energy between these two poles. And there is a resistance of the tissue, a selective resistance. That is the reason why the electricity goes through the septum, and through the nectar of septum that we have on the tissue. And as we are able to selectively heating those septum and those collagen, that's the reason why we have a best retraction. So first important things is to know the physics of this kind of technology. Is electricity, is bipolar, it comes from the septum, and that's the reason why we are heating the septum. And collagen is not only in surface, but also deep. This is bipolar radiofrequency. This is a video that shows you how it works. And this is like a electrocautery. So is a selective electrocautery, and something that we see also during a conventional abdominoplasty. And this is the network that we are used to see when we make a dissection. We that are surgeons, we see it during abdominoplasty, during a lift. So it is very important to treat all these septum, because the retraction will be much stronger. There are many papers. If you are interested on it, I can send you any kind of paper, because it's more than 8 years that I'm using this technology. So it's new, but not so new. Of course, this company every year is going to develop new NPs, but this is not a so new technology. So we have a good learning curve, and we know that if we use properly, we can achieve this kind of results. This is for me one of the most important slides we have to keep in mind. Basically, we need to achieve a temperature in order to have the biological effect, because this is a cannula that delivers heating. So we are heating the tissue, and depending on the tissue that we have, we will expect an effect. So if we have on the deep layer, and we can use 55, 60, 65 degrees, we will achieve the lipolytic effect, and we will be able also to heat the septum of the network of the subcutaneous layer. On the surface, we need to heat the dermis of the surface. We need the collagen denaturation. So we need to achieve 40, 41, 42 degrees. So these are the temperature that we want to achieve. And that's the reason why we need to set this temperature. So internal temperature is, I always start with 55. And then if I want to go faster, I use 60 or 65. And externally, I use 40, 41, 42. If the skin is good quality, you don't need to eat too much. So if you have a thick dermis, if you have a male, if you have a young patient, if you have a good skin, with the 38 degrees, 40 is enough. If you have a bad skin, you need to heat more the skin. So you need to reach 41, 42 degrees. This is very important. And internally, I start with the 55 degrees. If I see that I'm very slow, I push the internal temperature. I increase until 60, 65 degrees. 5 to 5 is enough. I don't need to use 70 degrees, but if necessary, you can use it. But I can tell you that with 60 degrees, 65 maximum is enough. The concept is that we need to homogeneously heat the tissue. So this is not reach the temperature as fast as possible, but we need to cook homogeneously all the temperature. So this is a slow food, no fast food. I'm Italian, and I strongly believe in the slow food. How much energy we need to deliver? This is another question that in the training the people also always ask me. Usually there is a guideline that tell you to deliver in the body 10-15 kilojoules for end, for a thermal zone, like this. Okay. If you have a thick layer, go to 15 kilojoules. If you have a small layer of just the skin, 10, even less than 10, it's enough. Okay, this is in the body. In the face, I usually use half of it. So for a face and neck, I use 6-9 kilojoules, and for the face, 2-3 kilojoules is enough. But most important than this is the clinical endpoints, as you can see here in this slide. So I use clinical endpoints because depending on the feedback of the tissue, I will be able to see the sign of the result. So in the deep layer, I heat the tissue until I feel that the fat is liquefied, until I feel that there is no resistance in the tissue. So this is my endpoint. And superficially, I heat the dermis until I reach 41, 42 degrees. That is my endpoint. So basically, I have the guideline. That is what I told you: 10-50 kilojoules for hand and half in the face, and the clinical endpoint. So in deep layer, when I see that fat is liquefied, and superficially, when I see that the dermis is already heated. Why I decided to buy this technology? 8 years ago, I was one of the first in Spain. Because we have the temperature control. That is the key point. The key point is that if you are heat and you don't know what is happening, you can have a disaster, you can have a danger, you can have a problem. With this handpiece, we are able to check the internal and the external temperature. So we exactly know what is happening inside and outside. That is very. The learning curve is quite easy. I have most of my colleagues that after 6 months, they have similar results to mine. So this means that the system works and it's quite easy to have a good result. Of course, you need to have your personal experience and learning curve. But once you know how it works and when you know parameters, and if you have the right indication, you will see good results. So internal and external temperature. I told you the external temperature, basically between 40 and 42, is externally the temperature is enough in order to have the collagen denaturation, and is enough in order to be safe, because we need not to exceed 40-42 degrees in order to don't have burning. And internally, we are talking about 55, 60 degrees usually is what I use in order to homogeneously cook the tissue. We have different handpieces, and this is very interesting because we are able to achieve and to target any area of the body. So abdomen, flanks, inner thigh, neck, periorbital region, mandibular line, hyperhidrosis, up to you. So keep in mind that the name does not match with the area. I can use a FaceTite also for a knee, if it's just skin and is a small area. I can use the FaceTite for the neck. I usually use FaceTite for the neck. I don't use the neck tight for the neck, because for me it's much more easy to use it. And you can use also the neck tight for inner arm. So once you know the area that you are going to treat, choose the handpiece that is much comfortable for you. The body does not recognize any different handpiece, so it's just how comfortable you want to work and what is much more comfortable for you. For the face, we have two handpieces, that is FaceTite and AccuTite. FaceTite, you can see, is a 10 centimeter, 1.3 millimeter. I love it. I try to use it as much as possible. And AccuTite is the smaller one, is 0.9, it's a centimeter. You don't need even to make any kind of incision, so it's very useful when you want to treat very small area. When I use FaceTite and when I use AccuTite, you can see the FaceTite is the blue one and the AccuTite is purple. Basically, for the neck, I use always FaceTite. If I have to do face, neck, and the other area, I try to open just one handpiece. That is the most logical option. So I use a FaceTite for the submental area, for the mandibular line, and if I have also to treat the inferior and middle third of the face. If I have to treat a small area, for example, a jawline, or for example, a sulcus, or for example, periorbital area, with AccuTite, it's much more comfortable and it's much more precise. But keep in mind that AccuTite is not less strong than FaceTite. AccuTite is even stronger. So you need to be very expert in order to use it, because if not, you will reach a temperature quite faster. So my recommendation is try to start with the submental area in a good patient with a good quality of skin. And once you feel comfortable with FaceTite, move to AccuTite, because AccuTite is a very precise but very strong. It concentrates too much the energy, so you need to be very, very, very precise. But up to you. You can use AccuTite and FaceTite in any area. There are doctors that prefer AccuTite for the submental area, and you can treat it perfectly. Keep in mind that in the same platform, most of you know it, we have also the Morpheus. Fractora, we consider it an old technology, but Morpheus is a new technology, and we have 4 millimeters of external RF fractionated radio frequency. So we are able to move from 4 millimeter to 1 millimeter. And usually I combine, when I'm going to treat a submental area or when I'm going to treat the face, I'm combine the FaceTite or the AccuTite with the Morpheus in order to have a full thickness treatment. So I go deep with the FaceTite, and then I move superficially the Morpheus. I don't use 4 millimeter because I have already used the FaceTite, but I can use the Morpheus 3 millimeter, 2 millimeter in order to have the dermis stimulation, maximum dermis stimulation. So as much we stimulate the tissue, as better it will be the retraction. Keep in mind that with the Morpheus, we are at just the tip of the system. So that is an important thing. And we need to know where to concentrate the energy. So what I do, the Morpheus, we will have a special presentation for it. But basically, when I combine Morpheus with the FaceTite or AccuTite, I use Morpheus at 3 and 2 millimeter, and I use between 40 and 50 watt of energy. If the skin is a good skin, is a white skin, I use stronger parameters because I have less risk. If I have a dark phototype, I use less energy. So I use 25, 35 kilojoules. This is what I usually use, and I try to go deep. I use just 3 millimeter because remember that melanocytes are on the dermis, but superficially dermis and dermis. So as superficial we are, more risk we have of post-inflammatory hyperpigmentation. So keep in mind it. This is the embrace treatment. So treating the full thickness, all the areas. Indication. Keep in mind that in order to achieve the best result, we need to have the right indication. Like always, if we have the right indication, we will see the best result. So I position it in my mind, this kind of treatment between the medical aesthetic treatment, like resurfacing, and so is in that one fielder that say I want something that lasts more. Patients that are not good candidate for facelift because they don't want a surgical look, they don't want a scar, they don't want they are afraid about the anesthesia, and they have mild, moderate laxity of the skin and a good amount of fat and not so important laxitude of the muscle. All these kind of patients are good candidates for this kind of treatment. So there is a huge market all these kind of patients. And many doctors ask me how much you charge for it. I charge because every city and every region have its own prices, but usually I charge between a FRED and a facelift. So that's what you need to have in your mind. In your region, ask or look how much you charge for a FRED, look how much is the average for a facelift, and put something in the middle. Of course, depending on the area, if it's just neck or if it's also face, mandibular line, and all this stuff. Keep in mind that this is not a substitute of a facelift. So if you have platysma facility, if you have infraplatysmal fat, a lot of it, and if you have a ptosis gland, these patients are not good candidates. You can do it, but you need to tell the patient that you will will not see the best result. So you have to tell the patient the truth, because if not, the patient will not be happy with the results. Contraindication and the one of radiofrequency. So keep in mind the pacemaker, keep in mind pregnancy, keep in mind any illness or localized illness of the area that you are going to treat. And these are my marking. So basically what I do, I treat the submental area always because I want to change the cervicofacial angle, and the submandibular line is between the mandibular line, the yoid bone, and the sternocleidomastoid. Then, if necessary, I treat also the neck, because in the neck we can have a slimmer neck if necessary, and if necessary, you can also treat the mandibular line and the inferior third of the face. The red dot are the access point. So these are 2 mm incision. I'm talking about the FaceTite in the submandibular line, infraauricular access point, and if necessary, also a preauricular access point. So these are the 3 areas that I usually treat, and you can also move into the periorbital area, but I'm going to treat it in another workshop. And keep in mind the red area that I marked, that is 1.5 centimeters below and above the mandibular line. That is the area of the danger zone, the nerve. So this is very important because this is very superficial, and is very easy to damage even with infiltration, this area. So keep in mind it that you can have a problem with this nerve, and you have to talk with the patient before always. In every treatment, I talk with my patient before. I say, because this is a thermical treatment and we are going to hit the tissue. In some cases, I tell her between 8 and 10% of cases, you can see some weakness of the area, and you can have asymmetry of the mouth because of the heating of the muscle and of the nerve. If you tell the patient before, the patient know it and don't care about it, because I told them that it's a transient condition and it lasts 2 to 3 weeks. But if you don't tell them, they will be very afraid and they will call you 10 times per day. And so keep in mind this, because this is one of my tips and tricks, and it works very well. And I will tell you how to avoid this problem. I will show you in the presentation and now in a video that I have. This is a local procedures, and I do it under local anesthesia. Usually 30 minutes before I give the patient midazolam or Valium in order to have the patient as much relaxed as possible. Then I use a very high concentration anesthesia infiltration with 250 of saline, with 40 ml of lidocaine 2%, with 1 adrenaline and 3 cc of bicarbonate. It works very well because I have no bruising, and I remove after the treatment this liquid with the fat that is already melted, so it's easy to have a good a good and safe result, and patient don't feel pain. These are the parameters that I use: 42 centigrades for the external, and between 55 and 60 internally. And for the submental area, usually I use 6-8 kilojoules is enough, and I use 1.5 kilojoules more for any area, additional area. So keep in mind that in the deep layer, I heat until I feel the fat is liquefied, and superficial until I feel that collagen is heated. So basically, I set internally 55, externally 41, 42. Then I start to heat the submental area in the subcutaneous layer. I'm between the platysma and the skin, and I heat until I feel that the fat is liquefied. Usually I deliver 2.5 in the medial zone, and other 1.5 for the infraauricular access point. When I have done this, I move superficially and I heat the skin and the submental layer until I reach 41, 42 degrees. And the skin and the face is very strong, so we are able to achieve 41, 42 degrees easily. Then, if you have a thick neck, big neck, you can go just superficial. You don't need to go deep. Why? Because we don't need to remove too much fat, because if not, you will see skeletalization of the neck and you will see platysma bend. So take care about it. And just superficially, in order to improve the horizontal lines, wrinkles, and until you reach 41, 42 degrees. Keep in mind that before the treatment, I always tell the patient to show the teeth in order to see if you feel the bends. Because when you remove the fat, sometimes the patient will see an improvement of the bends because they were covered with the fat. This is why you have to tell the patient always before, that you need to possibly you will see the platysma bend after the treatment, but no problem, because we can fix it or with the Botox injection or cutting it with the silk inside. I will prepare a small workshop also in order to show these tip and tricks. If necessary, you can also treat mandibular line, but take care about the nerve. Just retrotransant treatment, and you can eat also the face in order to have a shrinking of the face and a more triangular ovalar face. At the end, I always aspirate. Why? Because I wanted to remove the liquid that I inject, and I wanted to remove the fatty acid that I produce for the fat melting. So it's it's 5 minutes procedures, and you aspirate 10, 15 or more. You don't need the aspirator. You can do even with a syringe with vacuum in your consulting room, but is useful. One, because you remove the adrenaline, the lidocaine, and the fatty acid. And two, because you see an immediate result, faster result. Because if you leave the fatty acid there, you need the macrophages go there. They need to be the drainage with the lymphatics. So you have 1 month of inflammation of the ear. So it's very interesting to have this kind of procedure at the end. I will show a small video of how I do it. Look, the patient is awake, and these are the access points that I always mark it when the patient is lay down in order to work comfortable. And I'm starting to infiltrate. You can inject with a syringe of a 20, or you can inject with a pump, step by step, very slowly, because the patient is awake. This is my trick. I suspend the skin, and I'm subdermical, the network, and I am on the nerve. I physically separate the skin from the nerve. This is my trick. Once you inject this area, the area of the danger zone of the nerve, with a lot of liquid, you are safe. So you have less risk to damage of the nerve. And since when I do this maneuver, I have a less problem with the nerve. So what I do after I inject, I usually inject 80, 100, 120. I don't care because I'm going to remove it after. I heat the subcutaneous layer, and then I move superficially. You see, until 42 degrees. So I try to heat as much as possible. And on the mandibular line, I use retrograde heating in order to be very precise, in order to be very, very superficial. I'm on the nerve, but I'm separated from the nerve. That's the reason why I don't have to risk on it. Then what I do, I aspirate. You can see with a syringe, you can do with a suction system, with the PAL, with whatever you want. And then I combine with external RF. This is a Fractora, but you can use it with the Morpheus. Remember, use it Morpheus not 3 mm, but not 4, but 3 or 2 mm, because we want to improve the dermis. If you want to improve the wrinkles, you can use 1, 2. Depth, I mean. If you want to have the tightening, I use 3, because as deep you are, better for the tightening. And remember, the energy of the Morpheus, if it's a white phototype, you can use 45 or 50, even double step. If it's a external one, if it's a dark phototype, better to use less energy, 25 or 30 kilojoules, and just 1 step. You can see this is an immediate result. 2 days and after 2 hours and after 2 days, you see the stitch. There is immediate result. Why? Because I heat and I aspirate. And when you aspirate, the skin is able to shrink and to retract very fast. Of course, after 1 year, you will see the best result. You see the definition of the cervical facial angle, the mandibular line, the neck elongation, and all this nice result. This is a question that I make to myself, and also to the audience. Why we resect it? We are used to doing facelift resection, periauricular resection. We know that skin is an envelope, so it's going to adapt depending on what is inside, and we are going to remove what is inside, that is the fat. First of all. Second of all, we are going to heat the tissue. So it's like an entrecote when you are going to heat it. So it's going to shrink that skin. And geometrically, we know that 2 of the sides are always longer than the other side of the triangle. So these 2 are always, the sum of it are always longer than this one. So geometrically, this helps us to know that we are able to achieve the improvement of the cervical facial angle even without skin resection. You see, this is another immediate result. If you have a good candidate with a good quality of skin, we will see almost immediate result. I like very much submental area, and I suggest you to start with this area because we are able to see immediate result, and you can combine after with some fillers. And this is what aesthetical doctor put it a little bit more for me, but you see then a projection of the submental area with some filler, and you see almost immediate result. These are always result, improvement 2 weeks after, 1 year after. Male, take care about the beard, because sometimes if you eat too much, you can have some transient alopecia. So always tell the man about this option, and try to not to use the stamp technique. So try to eat homogeneously. You see, even these hard cases with a very big face, very squared face, you look the face of this patient, we are able to achieve this kind of result. We are able to remove fat. We are to have a liposculpting of the face, and this will help us to achieve a very nice result. Look the quantity of skin that the fat that we are going to remove, and the skin will adapt, it will retract, and we will see this kind of nice result. This is another patient that asked me for a facelift, but at the end I do just FaceTite, face, neck, and superior blepharoplasty. You see a nice result, improvement of the cervicofacial angle, improvement of the mandibular line, and improvement of the face of the either face of the case. Look, this patient that have done a lot of things. She has a collagenopathy. Look, this is just skin. And there is no fat here. It's just skin and muscle. You see that even this kind of patient, you have to go just superficial. You don't need to go deep. You can achieve this kind of result, a nice result with a very important tightening. She had many sessions of fillers, many sessions of external radiofrequency, but nothing seems to work with her. And with this kind of procedures, of course, strong energy, 42 degrees, we are able to achieve this kind of result. Even only with the Morpheus alone, with a full thickness Morpheus, so 432 millimeter, 55 watt, double stamp, 3 sessions every 1 year, every 1 month and a half, you are able to achieve this kind of result. Even in acne, you are able to combine Morpheus with salicylic peel. We improve the quality of the dermis, we stimulate the glands. That's the reason why the patient refer less activity of the glands. You see, even after facelift, you see the scar, submental scar. See the scar on here. She has some massaging fat and skin on this area, and she asked me to fix it. And you see, without touching the scar, the semi-ugly scar that I should have fixed it, we are able to have this kind of tattooing. So very, 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 very nice and very, very interesting. Keep in mind that if you have a patient with a secondary surgery, with a facelift, or if you have a patient with threads or the other treatment, you have a fibrosis. So take care, because the patient with fibrosis in this area have a lot of absorption of the heating. So you need to use less energy or to be slow. Don't use a high parameter. I use 50 internal temperature, because it's enough to eat this kind of treatment. You see the retraction that we are able to achieve just with the FaceTite and Morpheus without touching the scar. Post-care, I tell the patient to have the first 2 days the compressing garments on the neck without removing it, and after the first 2 days, just when she's at home, in order to have a good recovery time. I give anti-inflammatory during 1 week and augmentin during 3 days. And if I put some stitch, not always, I remove it after a few days, usually 5-7 days. And I suggest the patient to have massage in order to remove the edema, not bruising, but edema. My side effect. I always have edema because I'm eating the tissue, so the answer is a swelling, but usually is not too much. I don't have too much bruising because I'm very generous with infiltration, and my infiltration has 1 ml of adrenaline in 25 cc, 150 cc of saline. I always have a fibrosis, and I will show a slide on it. I don't have a permanent nerve lesion, but I have transient paresthesia. So I always tell the patient, usually between 7–8% of it. And I usually don't have a burns, but I will show you that you can have burns. And keep in mind the platysma band, that you will see platysma band when you remove that fat. So I always tell this to the patient. I told you that if you use if you put the right parameter, you will not see burn. So how you are able to see this kind of problem? This is my patient. This is a small burn of the area. And basically, the concept the problems are two. Usually, you have burn when you overheated the area close to the access point. So especially when you use a fanning technique and use this kind of vertical vectors that I like, and they are very good, you can overheat the area close to the access point. So in this area, you can have this kind of problem. You can have some small burns. So keep in mind that this could be a reason, a way to have burn. And the other way is that when you use a straight cannula in a curved area and you go through the end of the cannula, here you are more superficial than in the middle and also close to the access point. So at the end, you can have some stamp burns if you repeat in the same position and you are very superficial. So in order to avoid burn, I suggest you to stay in the middle, not too close to the access point, not too far in the cannula. Don't go until the end of the cannula. And the other suggestion is stay more time peripherically and less time close to the access point. Don't go close to the access point, because if not, you can have overheating. And when you have patient that has done many treatment, like Endiva, like Freds, and like this, lifting, take care, because when you have a fibrosis, tissue has more captation of the heating. So the patient that I show you made a lot of Freds, a lot of previous treatment, and I felt when I do the treatment a lot of fibrosis. That's the reason why I had this kind of problem, even with the right parameters. The other problem is this one. So take in mind and don't be afraid about it, because if you do many of this treatment, you will see one of these patients like that. So I have a patient like that even every month. I have this kind of a patient. Why? Because I'm trying to be very generous on this area. I like to contour the mandibular line, and if you want to contour the mandibular line, you can hit the nerve. So this is not damage of the nerve, and unfortunately, it's very, very difficult to have a permanent lesion of the nerve with this kind of system. But you can hit it, and even with the infiltration, you can have the neuropraxia of the nerve. So my first suggestion is tell before the treatment the patient that could happen. If it happens, it lasts maximum 2-3 weeks. Second suggestion, inject more liquid close to the mandibular line, 1.5 centimeters below and above the mandibular line, in order to separate the skin from the nerve. Third suggestion, use the infraauricular access point. There are doctors that use this access point in the area between the depressor angulus oris and the mandibular line. This access point is a very expert access point. You can use it, but it's very easy here to have a problem, because here the nerve is very, very superficial. So I suggest you, especially if you start, try to stay far from it. So try to stay in the infraauricular access point. And when you do it with the other hand, with the left hand, check where there is the mandibular line in order to have the treatment to stay far from the nerve. If you have it, no problem. Tell the patient that he's going to solve it, because it's very difficult to damage the nerve. And give the patient ibuprofen twice a day, 600 milligrams. Give the patient dexamethasone, that helps in order to recover the inflammation, 4 milligrams during 1 week. And if necessary, you can also give them pregabalin, Lyrica, 75 milligrams, 2 times per week during 1-2 weeks. Okay, and call the patient every day. That is another important key point, is that fibrosis. You will always see fibrosis if you do it properly, because fibrosis is your glue, helps you to fix. And if you have fibrosis, you need to know if it's a good fibrosis that will help you to have a good result, or if it's a pathological fibrosis. If you have a pathological fibrosis, you have to treat as soon as possible. Pathological fibrosis is that cord that is very painful, strong, touch it, this is painful, patient complain about it. So this is not good, because if you feel a generalized fibrosis everywhere, this is okay and is going to solve with the massage alone. But if a strong, tough fibrosis, try to treat as soon as possible, because once you have a 6 month available in order to treat it. After that, it's be fixed fibrosis, and you can have a stable problem, and you need to fix it just with surgery after 6 months. So I suggest you to use to treat it as soon as possible, once per week, with carboxy therapy, with ultrasounds, with PRP, with the lymphatic massage. Try to improve the vascularization, because this is a overproduction of collagen in those areas. So you need to disorganize that tough fibrosis, and that's the reason why you need to inject intralesional with the needle, PRP, carboxy therapy, in order to improve the vascularization. You can also use some cortisone, but I don't like cortisone because they block the collagenesis. But there are doctors that can use it. But do it as soon as possible. I check the patient and send to my nurse. The nurse do it once or two times per week during 1 month or 2 months. Okay, since why I do it, I have no problem with fibrosis. I love fibrosis because it will help me to have results. And keep in mind that if you see the sign of the line, it means that you were very superficial. So in this case, you needed to go a little more deep. In this case, the cannula was too superficial and pressed too much with the handpiece, and that's the reason why you see the line of the dermis, and that is fibrosis. So you need to stay a little bit more deep. You don't need to go very, very, very superficial. Try to go deep, because if you reach 42 degrees, you will be able to hit the dermis anyway. Keep in mind that the internal treatment, FaceTite AccuTite, is just 1 session, and the external one, like Morpheus, can be repeated every 1.5 months to maintain the result. Another suggestion is that try to prepare the skin as much as possible, because of course if it's a bad skin, laxitude, is a post-bariatric patient, if he's an old patient, he's a vegan, a vegetarian, that skin will not be able to retract, because there is no capacity for the retraction. So you need to feed the tissue. You need to have the best quality in order to see the best result. This is like an horse. I always do the same comparison. If you have an horse and you don't feed it, even if you stimulate, it will not ride. And that is the same concept. In order to have the best result, you need the stimulation, that is body tight, or it could be the needling, or it could be the filler, or whatever you want. But you need the neocollagenesis, you need the retraction, and you need the body has amino acid in order to start the collagenesis. And you can prepare with the hormonal balance, with the multivitaminic, with the mesotherapy, with the carboxy therapy, whatever you have in your practice in order to stimulate. And I give this to all my patients, and I patented this formula because it has the highest concentration of essential amino acid. So the essential amino acids are the one that the body is not able to produce. So if you have a valine and lys in your body, you will start collagenesis. If you don't have, the body will not be able to produce from other amino acids. So collagenesis will stop. So that's the reason why it's important to have valine and lys in your body. How much it lasts? If you do it properly, you will see nice result and stable result. This is a patient that I operated in 2013. You see here, Is a photo of 2015, and I call her every year in October in order to see how stable is the result. And you can see after 2 years, 5 years, and 6 years that stable result is almost stable, almost a similar result. Why? Because of the fibrosis, because the tissue, we change the structure of the tissue. That is the reason why the result is stable. Look, the patient in 2019, and same result and same patient, of course. Just last slide. You see, this patient is not candidate for a facelift, for a FaceTite. This patient is candidate for a facelift. Why? Because she's old, because she has a very bad skin, she has a laxity of the platysma, and you cannot promise a good result to this patient, okay? So I always, this patient try to convince for a facelift. But if the patient does not want a facelift, what I tell her, look, what we can do is to do this treatment, you will see a result that will not be the best, but you will see an improvement, and if necessary, we have time to do the scar. So in a second time, we can do a secondary surgery to have just the small facelift with resection of a small amount of skin and some application of the platysma. You see, in this case, I've done just FaceTite, no scar. There is no scar here. You see a nice result, but I was lucky, and the patient have a good retraction. But keep in mind that this is not the right candidate. And you see the TC scan of this patient. You see the preplatysma fat, the skin, and the platysma looks how they are fused together. That is the nice concept, that all the tissue are fused together, and that's the reason why the result is stable. Keep in mind that we are talking about a tool. So I show you good result, bad result. That this is always a theme of expertise and a learning curve. So you need to have your learning curve, and I encourage you to not be disanimated. You need to understand how to work the technology, then do treatments. When you feel comfortable, you will see step by step the best result. But when you see a bad result, I don't think that the system is not good. I think that the operator or me was not good or right in that treatment. So it's like when you see a surgery. I don't think that scalpel that used that surgeon was not good. I always think that the technique that used in that patient was not good. That is the thing. So it's a tool in our hand, and depending on ourselves and the right indication, we will achieve the best result. Grazie mille. I saw you that you were very concentrated, or you very slept. If you have any question, we can have, I think, 10 minutes or 5 minutes of question. Somebody hear me?
Doctor, ¿me escuchas?
Te escuchamos.
Sí.
Hola, doctor. Tenemos algunas preguntas que han hecho los asistentes. I
Sí.
say in English, okay. Regarding brow lift by AccuTite is beneficial?
Yes. In a week, I will have another workshop where I will talk about the AccuTite in the periorbital area, and also in the face, but especially in periorbital area. So I can tell you that it works, but don't start with AccuTite for brow lift. Start with the other area. I told you, with the submental area, with the small jawline. When you feel comfortable, you move in the periorbital area and the eyebrow, because it's very tricky. But I can tell you that when I treat it in the eyebrow, what I do is I put 3 weeks before at least Botox in order to relax the orbicular muscle, in order to don't have any kind of force that push me downwards the eyebrow. Then I do AccuTite with the pretracheal access point and hitting the lateral third of the eyebrow. And in the same session, or after 1 week, I put a thread in order to have a stability of the eyebrow in the position when I want that is going to retract. And in my hand, it works. And you have 4 millimeters, 1 centimeter, or 1.5 centimeters of elevation.
Okay,
How long do you think swelling down time? No?
Yeah, that's it.
It depends on the energy that I have used, but I can tell you that with this kind of infiltration, usually downtime is 3 days. That is the most important one. 2 days, the time that I tell the patient to stay with the compression garment all the time, and then you will see some edema, but there is compliance with the routine. So you can work and except you are an actor or somebody that you need to stay perfect, but is not so important swelling. I show you also immediate result. Usually something that is acceptable, but depending on how strong you were. And the other question that there is in the chat, how much energy you deliver in the mandibular zone. I told you, usually I use in the neck between 6 and 10 kilojoules, because here I'm very strong. I want to have the best retraction in order to have a cervical facial definition. In the mandibular line, I'm very gentle, I'm very superficial, and I put 1.5 kilojoules. And also in this face, usually I put 1.5 kilojoules. So 1.5 here, 1.5 here. Why? Because here I needed to be superficial. I don't want to go deeper because I don't want to damage the nerve. So 610 here, 1.5 here, 1.5 here. Of course, symmetrically. The treatment is always with the liposuction. This is another question that always the doctor do me, and I tried to answer during the presentation. Not necessary, not always. Liposuction is a good complement. I told you, if you have reached the right temperature, if you have already heated the fat is there is the lipolytic effect. You have already damaged the adipocyte, the membrane of the adipocyte. So there is death of the lipocyte. So you will expect the same result. The difference is that if you aspirate, you remove the fatty acid that the lipolysis that cause of the lipolysis you have there. If you don't remove that fatty acid, somebody needs to go there and remove it. Who are those? The macrophages. So macrophages and the lymphocyte means inflammation. So the only difference, the result will be the same. But if you don't aspirate, you will expect more inflammation. How much inflammation? We don't know. But of course, depending on the volume. If we are talking a big neck, if you are talking about a big neck with a big fat, I suggest you to remove because it's a lot of fat. Better to remove because you will see a faster result. If you have a small neck with small volume and you have just the skin, not necessary to aspirate. Es bueno hacer Morpheus. It's good to do Morpheus after FaceTite. You know, I like to combine because when the patient has infiltration and the area is anesthetized, try to do as much as possible in order to have the best result. So for me, I try to stimulate the dermis and the subcutaneous layer in order to see the best result. And as the Morpheus is possible to use for the same patient 3 times, I told the patient, I will do the first session during the treatment because you have already the anesthesia and it's better for you. So I always combine. But if you do it properly, you can use just the FaceTite or the AccuTite, up to you. Keep in mind what you want to stimulate and how strong and you want to stimulate the tissue. So your target. AccuTite and FaceTite is subcutaneous and the deep dermis, of course, also skin. Morpheus is fractionated dermis, deep dermis, superficial dermis, and epidermis. And of course, the phototype. If it's a dark phototype, you can avoid the Morpheus. You will see a faster recovery time. Or if the patient don't want to see the pixel, because the pixel lasts 1, 2 weeks, 3 weeks. So if the patient don't want to fix the pixel, don't see the pixel, because you can put some maquillage, you can do it. We are very interested in AccuTite and blepharoplasty. I told you, please wait, because I have a presentation. Is a very interesting theme, but is needed to have a workshop for it. So I will show you next week a workshop in AccuTite in blepharoplasty. But I can tell you that what I told you. I have a training. I don't know if one of the audience there is also Liliana. We do in a training a treatment of the periorbital area, and I told the patient and I told the doctor that it was not the best option to start with periorbital area, because usually the patient that have a problem in this area has edema, has a liquid retention, so is a risky area. And if you are heating the area, you have stimulation of the lymphatics. So you will expect edema of this area. And is what I told the patient and the doctor before starting the treatment. And the patient say, okay, no problem, I don't work, I stay at home, no problem. We do the treatment. We have normal edema, something that was expected to have. The patient starting crying because of the edema when she saw at the mirror. Why? Because she saw the edema, and the first day is when you have a knock on the eyes. So please don't use AccuTite in the periorbital area for your first cases. Work in the submental area, work the face here is much more safer than the periorbital area, because here is very easy to have edema and it's very tricky, and you need to go under the muscle. So it's not easy to have a good result, and especially you need to have a good patient, because if not, he will not have the right compliance. But I will show you some tips and tricks in another workshop. Well, I think that is almost 1 year that I'm talking alone. So I hope you enjoy it. I think next week there will be a body workshop on body tight and tip and tricks. And stay tuned, and hope it was useful for you. And I give you all my contact if you have any kind of question. For me, it will be a pleasure to share with you my. There is another question for the improvement of the neck tight. We can do another session. Yes, if you see that you need if you need an extra stimulation, internal stimulation, you can repeat it. Keep in mind that if you repeat it, you will expect to have some fibrosis there, and it will be not so easy, but you can do it easily. Not so easy, but you can do it perfectly. So you can repeat. Wait at least 6 months. So I always tell the patient that in order to see the best result, we need to wait at least 6-8 months. After that, usually 6 months minimum, I check the result, and if she needs something more, I can repeat the FaceTite. Usually I don't repeat because I was quite generous in the first session. I've repeated the session 3-4 times during my career, but I can do Morpheus externally. improve the result or to have to maintain the result and to have a fidelization of the patient. In face changes are good, but in body not like so much. Your opinion? My opinion is that face and neck, paradoxically, is easiest than a body. Why? Because the quality of tissue is better. So the concept is that in the neck you will see almost immediate result, but in body you need to wait at least 1 month in order to see some result. So I agree with you. Face and neck, the results are faster. But if you have the patient to wait, you have stimulated properly the tissue, and the quality of tissue is good, you will expect the result also in body. I will show you in the next week result in the abdomen, in the flanks, in the legs, and in the arms. In the arms, I like it very much. And you will see that we are able to achieve a nice result. But you need to stimulate and to wait more, because the quality of tissue is not the same. Another question: what was the treatment you applied after the procedure to help tightening the skin? I applied the compressing garments during 1 month. I apply lymphatic massage and pressotherapy in order to remove the liquid that are inside and help the skin to retract. And if necessary, I apply carboxy therapy in the area where I see some focus or localized fibrosis. 1 for week during 1 month, usually. This is my normal protocol. I don't use external treatment. I don't use any radiofrequency since at least three months, especially if I went deep with body tight or FaceTite, because I don't want to add fibrosis and heating to other heating. So I suggest you to use ultrasounds, to use LED, to use carboxy therapy, to use pressotherapy, pressotherapy and lymphatic massage, but don't use heat treatment, or for example other radiofrequency or external radiofrequency. Don't use suction system, because we need to have the fixation of the tissue. And if you suck, we are not able to have the bridge of fibrosis that helps the retraction and the oscillatory or vibration system for the same concept. So I tell the patient to start exercise after 1 month, and always with some legging, with some compressing garments in order to have the tissue close to the muscle. Further aspirate fluid for improved retraction and fibrosis? Yes. The question is: manual and lymphatic drainage massage recommended for the aspirate fluid is recommended for fluid aspiration to improve retraction and fibrosis? Yes. I have already answered. Lymphatic drainage massage, I suggest the patient lymphatic massage and pressotherapy once for week, so 1 massage and 1 pressotherapy during the first month. Patient need to tolerate it, so I usually start as soon as possible after 3-4 days the procedures, and during the first month. Of course, pressotherapy for the body, pressotherapy for the face, not so easy. So I think that there are no more questions. One question more from Life Story. How much energy do you leave in mandibular zone? You need to be tuned. I have already answered to it. 1.5 mandibular zone. To start, don't go to mandibular zone. I suggest you. I used to infiltrate, but if you are starting with the FaceTite AccuTite, treat the mandibular line and aspirate some volume there, because the retraction on the mandibular line will help to improve the submental area, will help to improve the mandibular line. So not necessary, there is retraction is, when you treat this area, it retracts here, but it's like you have a phrase, internal phrase. So it will help also to shrink the other area. So even if you treat just the submental area, you will see an improvement of the mandibular zone. So in order to have less risk, especially when you start, I suggest you to treat very well the submandibular area, and you will see an improvement also in this area. Of course, if you have a jawline, you need to treat it, because this will not improve. Paloma, Nayara.
Yes.
Your experience, sensitive paresthesia. Last, my casuistic, 7–8% of cases, and it lasts, when it appears, 2–3 weeks. But I use those 3 tricks that I told you. Tell the patient, infiltrate very well the danger zone, use infraauricular access point, check always with the other hand where you are with the cannula. Since when I use these tricks, the paresthesia, I have very few cases of paresthesia, but of course it could happen. Well, I think
Doctor, yo creo que ya no hay más preguntas, ¿verdad? I think there are no more questions. I think this was the last one.
Gracias a todos, querido, for
thanks you. Go ahead.
Ciao.
Thank you,
Gracias.
Doctor. Thank you so much. Thank you so much. Thank you. Bye. Bye. Thank you.
Ciao.